Good morning, everyone. Today is October 5th. I'm Jessica Lovell, and we have an exciting announcement today. Reporters will hear first from our guests and then be given an opportunity to ask questions. When asking a question, we ask that you say your name and the news organization that you represent. With me in studio is Bob Page, President and CEO of the University of Kansas Health System. At this time, I'd like to turn it over to him. Bob.
Thanks, Jess. We couldn't be more excited today to talk about an evolution in healthcare in Kansas City and across our region, which will give patients and communities new opportunities to access the very best care. I'd like to introduce Tammy Peterman, President of the Kansas City Division for the University of Kansas Health System.
Thanks, Bob. This is a really exciting day for us. With us here is Stan Holm, President and CEO of Olathe Health. Bob and I have gotten to know Stan over the last many years, and we'd like to invite him to make a really special announcement.
Thanks, Tammy. Thanks, Bob. I want to start by saying how proud we are as an outstanding primary care and specialty care organization that we have provided as an independent health system for 70 years. It's through the efforts of our dedicated care team, which includes 2,300 associates and 350 providers, that we have served the needs of 5 counties through our regional network of 2 hospitals and 60 care locations. Today, I am pleased to announce Olathe Health and the University of Kansas Health System have signed a letter of intent for Olathe Health to join the University of Kansas Health System. A letter of intent, also called an LOI, is a written expression of both entities' intent to move forward with a deal, including summary of key terms and strong commitments that will be included in the final binding agreements. We began sharing news of this letter of intent with associates and stakeholders very early this morning. As one health system, we will enhance regional access to comprehensive, high-quality care close to home.
Thanks, Stan. Just like you, we started sharing the news of our health system throughout the morning. As the region's only academic health system and destination for complex care, we're excited to extend our highly specialized provider network to the Olathe Health service area, including Southern Johnson County and beyond. Tammy, do you want to take a bit more time and talk about how we got here?
Sure. Thanks, Bob. We've been discussing an affiliation with Olathe Health since 2019. And in recent years, we've been proud to work alongside Olathe Health to bring specialty physicians in vascular surgery and plastic surgery and urology to Olathe Health patients. This work created a really strong foundation for expanded access to health care for our communities. From working together, we already know a lot about one another. We know both organizations share a commitment to providing the very best care to patients in our region. Because of this, we're signing an LOI, and that was a natural progression of our existing relationship. The first step in joining our organization is this letter of intent, which includes a summary of key details. When Olathe Health becomes part of the University of Kansas Health System, significant investments will be made over time in current Olathe Health services, facilities, infrastructure, and technology. We're really excited for the future and the opportunities our combined resources will offer patients, providers, staff, and of course, our communities. I'd like to turn it back over to Stan, who will share a few more details.
Thanks, Tammy. This next step reflects our commitment to ensure our communities have access to a thriving health system with high-quality care for generations to come. With a shared focus on quality, safety, service, and people, we'll be able to provide additional access for patients with serious conditions and needing specialized care, which enhances our ability to provide the continuum of care in one system. To that end, the letter of intent is the result of extensive consideration and approvals by the boards of both organizations with support from senior leaders. Here are a few LOI details. Olathe Health's 2,300 associates will become employed by the University of Kansas Health System, with senior leadership remaining in place. Also included in the letter of intent is the commitment by the University of Kansas Health System to expand Olathe Health's current services and enhance physician recruitment. This letter of intent reflects a commitment to our patients, providers, associates, and our community. It is important to note nothing changes today for patients and our communities. In the days ahead, patients of both organizations will continue to see the same providers they know and trust as Olathe Health and the University of Kansas Health System continue to provide compassionate, high-quality care.
So you may wonder, what's next? Our teams will spend time getting to know each other operationally as we go through due diligence. Due diligence is a time to talk about integration planning, service, quality, safety, space planning, technology, communication, and many other areas critical for two organizations to successfully become one. I want to reiterate something you said, Stan, which is that patients of both organizations will continue to see their same providers they know and trust at Olathe Health and the University of Kansas Health System. Looking ahead, one of the details in the letter of intent that excites me is the promise by the University of Kansas Health System to support Olathe Medical Center's goal of achieving magnet designation, which is the nation's most respected designation for nursing excellence. We know there will be questions and we'll continue to communicate as we have more answers. The next step in this process is really complex, with both organizations thoughtfully working together to review and provide information. We promise to keep you updated as we continue through this process. Bob, do you have some final thoughts?
I do, Tammy. While both organizations will be stronger together, it is the patients and our communities that will benefit the most from Olathe Health joining the University of Kansas Health System. There's no question demand continues to grow for highly quality, specialized and subspecialized patient care. At the same time, patients want a comprehensive healthcare experience where their routine and complex healthcare needs can be met with one seamless system. Our combined health resources complement one another well to create that seamless experience.
Bob, Tammy, Stan, thank you so much. And we are ready now for reporter questions. Please remember to say your name and your news organization before asking your questions. So let's begin.
Hi, this is Tia Johnson with Fox 4. One question I have is, will this merge impact the clinics that Olathe Health has?
Great question. We are looking at this for the entire Olathe Health System, which includes Olathe Medical Center, Miami County Medical Center, and our clinics that are distributed across the counties that we serve.
Any other questions? While reporters consider their questions, go ahead, please.
Sorry, it's me again, Tia Johnson with Fox 4. Will this impact Olathe Health's partnership with the Olathe School District?
Our partnerships with all of our community network of organizations, we anticipate to continually being very strong. As you know, Olathe's presence and Olathe Health's presence in the communities that we serve have been there for over 70 years. And we do anticipate that that would continue. For example, last night I had a personal phone call with the superintendent of the schools, and he's been very excited about this opportunity, and we do expect this to continue to bridge in the right direction.
Other questions on the line? While we're waiting, I do have a question. And Stan, I'll start with you, and I'd like to hear from Bob and Tammy as well. But what's behind the timing of Olathe Health joining the University of Kansas Health System?
Jess, great example. Why now? I'd like to start by connecting some of the comments Tammy made earlier about building on trust over the last couple of years. The ability for us to connect to one another on alliances and strategies for the future did start several years ago. And building upon that and then looking at the pressures in the healthcare industry today that many healthcare organizations are seeing and feeling across the United States, we are impacted by that as well when you look at declining reimbursements, staffing shortages, and the labor costs that are there. But as we look to become one system, our board, a great board that looks strategically at where we need to go in the next 3, 5, 7 years and beyond, didn't just want to survive. We wanted to thrive for the communities that we serve.
Bob, Tammy, would you like to add?
Yeah, I would say, just like everything else, it all starts with relationships. Stan showed up about 5 years ago down in Olathe, following Frank Devicel, who was there for 47 years, who did a phenomenal job. We got to know Stan as soon as we got here. I think we invited him up here just to get to know him, and we liked him from the moment we met him. We saw that we had some opportunities to work together. We'd already worked together in some areas, and this was just a natural evolution. So the conversation has actually been alive and well for about 4 years in terms of developing this relationship over time. And when Olathe made the decision to not just survive, but thrive, and they came to us, and Stan came to us and said, you know what, we want a closer alignment with the University of Kansas Health System. It was music to our ears, and we were so excited about that opportunity. And I think, to Stan's point earlier, it's a tough time in healthcare right now. It just is. And so for organizations to come together, we probably have the best opportunity to thrive in this new environment.
So you mentioned patients should see no change in their health care during this due diligence period, but what happens after that? Who'd like to start with that?
Certainly, as we've already mentioned, that patients will continue to meet with their providers at Olathe Health or at the University of Kansas Health System, and we're moving through the due diligence process, and we have a whole lot of questions we have yet to answer, and I think what people can expect is that we are committed to making sure that we will have the very best care provided close to home. We also want to just enhance the opportunity to provide seamless care across the continuum, from simple and not as complex to very complex. I think that's yet another piece of the beauty of this relationship, is the ability to do this across even a larger scope and larger location.
And Tammy, if I could add, from the very day that I met both of you, we've agreed in like-mindedness that the patient will always come first. So as we are moving through this journey, we will always put our patients first in everything that we do.
And how long do you anticipate this process taking? And then why did you find it important to make this announcement today?
Well, I'll take a shot at that. First of all, the process will take as long as it needs to take. I mean, we are committed to make this work and to do it right. We thought it was really important, though, because due diligence takes time. And as soon as we could make the announcement, it opened the doors for us to begin to do the due diligence that's necessary for us to be able to finalize the agreement. So timing was really important to both organizations.
I'd like to add, Bob, that announcing an LOI in many organizations is something that's done behind closed doors. So organizations work through their due diligence, and then they announce the final agreement. It's another example of our organizations working together, that we are committed to transparency. And for us to announce the LOI today allows us to bring in our providers and our associates and all of those key stakeholders as we're going through this journey together.
I want to give out one last call for any reporter questions on the line today.
Hi, this is Kaylee with the Olathe Reporter. I was wondering if, I know this is pretty early in the process, but if there's any idea how much this letter of intent and the whole deal together will be costing?
It's a great question. Costing relative to the time we're all spending together to get to a final agreement, is to clarify, is that the question? Or the significant investments that are going to be made over the course of time?
Significant investments.
And as Tammy mentioned, if I could add that these investments, it's important to know this is not an asset purchase. This is a member substitution with two not-for-profit organizations. In doing so, we look at the investment that KU will be making in partnership with Olathe Health in relations to expanding services, facilities, infrastructure, and technology. So those are really going to be investments over time. So I don't believe we have a overall cost structure to that.
What we do know, though, is that Olathe Health is a phenomenal health system, very successful, and our goal is twofold. One, we've learned this as we've built the system here, and that is that patient care is best delivered close to home. And so what this does, it gets back to the seamless discussion we had before. We're going to keep patients in Olathe when patients should stay in Olathe. And when they need a higher level of care, they're going to come to KU and have that seamless care here. But this is all about supporting what's happened in Olathe. It is a phenomenal health system, and the University of Kansas Health System will continue to support what's gone on in Olathe for the 70 years preceding this agreement and for the years to come.
I think it's also important to note that we're talking about one system now. So making sure that every aspect of the system is successful. That's what we've always done, always making sure, as Stan said, that we're putting the patient at the center of those decisions that we make, but making sure that all aspects of the system and of the organization will be successful.
And we know that our Miami County Medical Center has communities that link to that organization. We have communities that link to our Olathe Medical Center. And then we also have that connectivity for a seamless process with the University of Kansas Health System. That is the vision of where we want to head.
Reporters, go on with your questions.
This is Tia with Fox 4. I apologize if you already said this, but is this effective immediately?
No, what's effective immediately is that we have a signed letter of intent. And so that's what is effective when our boards actually unanimously approved it 2 weeks ago. What now we're doing is starting the due diligence process. That's what happens. That's what begins starting tomorrow.
Other questions? All right, well, we want to thank our reporters for being with us today and joining us this morning, and all of you as well. We are going to send a summary of today's conference shortly with a link to this recording in case you need it. Neither organization will have any more comments in the short term. As things progress and there is a need to communicate more, we will reach out. In the meantime, go to kansashealthtogether.com for a news release and check back, as we will upload today's conference there. Thank you again for your interest. This concludes today's news conference.